Scientists are getting closer to developing a vaccine for RSV, but it's likely a year before we could see it. Right now, doctors are dealing with a surge in respiratory illnesses, and Circle of Health reporter Denise Sador has the latest on the RSV outbreak.
Not your typical Halloween for young patients stuck in the hospital, but this year is not typical.
Certainly, we've seen an increase in our flu and respiratory syncytial virus, RSV, numbers over the past several weeks.
At MemorialCare Miller Children's Hospital, beds are filling fast, and ER visits for influenza-like illnesses are up. Chief Medical Officer Dr. Graham Say says respiratory syncytial virus, or RSV, got an early start, and the flu is on its heels.
We have more flu currently locally and nationally than we've had in the last 5 years, so we may see a considerable early and quite significant surge.
The confluence of RSV, flu, and the ever-present COVID-19 spells trouble for young children. Not only can these viruses strike one after the other, doctors say reinfections are not uncommon.
Those are the big three that we're really worried about this winter. Wouldn't want to see any child with all three or more at the same time.
Besides getting the whole family flu shot and the latest COVID booster for eligible kids, Dr. Say says everything we've learned during the pandemic will help slow the spread.
Don't let your guard down. We want you to wash your hands, wear masks where appropriate when you're in close quarters with others, and socially distance when you can.
Before you bring your child to a busy ER, doctors say look for signs of respiratory distress. Is your child using their belly to breathe? Are their lips turning blue? Call your pediatrician for advice. As for COVID, Dr. Say says they're already seeing increased numbers in Europe, and the U.S. tends to follow.
Stay safe out there. It's going to be an interesting winter.
Denise Sador, ABC 7 Eyewitness.